Hey everybody, and welcome to the Dr. Mom Show. I'm so excited that you're joining us, whether you're watching or listening. And this is episode 14. We have made it. Whoop whoop. And of course, I am Dr. D, mom of three, your host of the Dr. Mom Show. And I hope everybody is having a safe and fantastic day, in addition to having a fantastic 2021, and that's WON. I hope your year has already been full of wins. If not, we are going to give you some wins, and my special guest today is going to drop some nuggets for you today so we can learn. Of course, don't forget, if you missed any previous episodes of the Dr. Mom Show, you want to check that out to learn more about myself and about the awesome information that we provide on the show. So before we get into our topic today, I just want to remind you that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So seek all of your medical diagnoses and treatment plans from your own provider. So today, as I mentioned, and like every show, I'm always excited, but today is extra special because our guest today is also a physician. So right now you are listening and watching a powerhouse of two female physicians who put together, we have 5 boards. So we're like quint boarded over here. So this is some knowledge right here. So you want to share it. You want to make sure you listen to it and maybe even re-listen to it. So our special guest today is a physician. She is an OBGYN, so that's obstetrics and gynecology. So she has delivered babies, taken awesome care of women. But in addition, she has pursued being boarded in both functional medicine and integrative medicine, which is awesome. So help me welcome today, Dr. Tara Scott. Woo! Welcome,
Thank
Dr.
you.
Scott.
So glad to
Well,
be
we're
here.
so excited. So before we start diving in and picking Dr. Scott's brain, which I'm like so excited about, about cervical health, because that's where we're focusing on today. So remember, if you have any female in your life, and I know you do, whether it's your mom, sister, grandma, wife, make sure you let them listen to this show, because this is something that's so important. And if you didn't know it, you'll know it by the end of the show. And in addition, January is Cervical Health Awareness Month. So we're just more aware of our cervical health this month. So we just want to highlight some things here on the show today. So again, Dr. Scott is an amazing physician, but she's also a medical director of the Integrative Medicine Clinic at Summa Health in Akron, Ohio. Akron, Ohio! I was telling her I did some of my rotations in med school there. So we left Cincinnati. We lived there for a little bit. And she doesn't even stop there. She is the CMO, that's Chief Medical Officer and founder of Revitalize Medical Group, which is a wellness practice. And we all need wellness and health in our lives. Yes, we do. But again, she doesn't stop there, right? I told you we are killing it today. She is a speaker. And she helps. So she is not only taking everything she does and made an awesome person of herself. And she's an amazing mom of 3 college kids, but she also shares her knowledge and helps other people with chronic health issues. And then she doesn't even stop here. With all that going on, she like squeezes in somehow running half marathons, right? Like she runs half marathons in every different state, which is going to be one of the questions, like how many states has she ran a half marathon? And she, of course, she loves traveling and being active. So again, help me welcome, give it up to the lovely, and she's gorgeous. If you're missing the video, you're totally missing out. You got to check it out on the YouTube. I mean, everybody loves having a hot doctor. I'm just saying it's more motivating. So make sure you get a doctor that you think's cute. So help me welcome Dr. Scott again. Yay.
Thank you, Dr. D. And thanks so much for doing this podcast, for all your listeners, for just having a heart for knowledge. That's great. And so I applaud you for doing this. I know it's a lot of work.
Thank you. Thank you. So before we delve in and kind of hit the more serious topics, I have to ask you, and I'm sure everybody wants to know, how many states have you ran a half marathon in?
So just to clarify, I just started that and then COVID hit, right? So I think I have 11 states.
Oh man, that's
done.
That's pretty good.
11
I
or
would
12.
say I've probably, and this is even like half marathon. This is me like if I ran on the treadmill or like ran on outside, it's probably 4 states.
Yeah, but I have done New York, so yes.
Yay!
Yeah.
So awesome. So exciting. So, well, I told you a little bit. I was just touching the surface of Dr. Scott's accomplishments, but I just want her to tell her a little bit more about herself.
Yeah, so I got my start at OBGYN and I was in a very big practice, very busy, delivered a lot of babies, did a lot of surgery for a long time. And then when my brother suddenly passed away of a heart attack at age 38, I shifted and focused on prevention because I felt his death was totally preventable because he had every risk factor. But the way we're set up in traditional medicine is you have to wait till you get sick to have a diagnosis and to have the treatment. So for me, that was kind of the impetus for me training in functional medicine and then integrative medicine.
And I love that. And you guys who follow the show, you know that I'm all about preventative medicine. I think it's so important. And part of why that's a passion of mine is because for some reason people don't take their health as a priority. And you're right. You know, everybody's scared of a heart attack or stroke because it happens like that. But people forget it's things like high blood pressure, high cholesterol, you know, those what we call quote unquote silent killers, that they're slowly eating away at your body and your organs, but it's not as fast as what happens with a stroke or a heart attack. But ultimately that is what could happen. So she mentioned she did OBGYN. So Dr. Scott, you mentioned you did OBGYN for a little bit, and then moved over to functional medicine. So you wanted to do preventative care. So why OBGYN initially?
Well, you know, that's interesting. So I did a 6-year program for med school and college. So
She's
I
a
was 20.
boss.
Yeah, so I was 23 when I graduated from med school. I was young and awkward around men. So that was one thing. I was like, I feel so much better relating to women. But also I liked the continuity. I have patients that I saw from teenagers through they got married, delivered their kids, and on and on. So I enjoyed that relationship and I just felt more comfortable with women. And I liked the mix of office and medicine and diagnosis, but also surgery. And, you know, there is nothing that beats delivering a baby. That you're allowed to be part of that amazing miracle of life. I mean, that has just been something. I miss it, but, you know, I think I was so privileged to be there as part of that journey for a lot of people.
And I agree, that is something special. If you haven't had a baby yet, there is something so special. And on the pediatric side, I've had, of course, just the honor and privilege that, you know, as pediatricians, we're sometimes needed in there if something's happening with the baby, if like the heart rate's going down or if it becomes an emergency, we're there waiting to help the baby. And it is something so beautiful to see that baby come out. And I love it when the dads cry. That's like my favorite thing. I almost want to be like, you have to cry because of what mama just went through. Like, I feel there
Exactly.
is a necessity to cry. But it is lovely. And it's so funny because at one point in medical school, I had always loved pediatrics, but at one point in medical school, I was like, oh, I really do like OBGYN because I think taking care of women is something special. And like you said, kind of like close to your heart. And what I found though is when I did my OBGYN rotation, as the baby came out, I found myself gravitating to the baby and I was like, bye, mama. And if you have not had a baby, when your baby comes out, you still need your OBGYN there because there's some things that happen after you deliver the baby that you require attention. So I thought to myself, and that wouldn't be fair to mama if I was an OBGYN and I was going over with the baby. So
I actually went to medical school to be a pediatrician.
That's so funny.
And then I loved my internal medicine rotation. So I thought about IMPs for a while.
Woo woo!
Yeah.
Med-peds, we're like meant to be BFFs.
Yes, for sure.
It's official. We're like, this is just a divine connection here. And then of course with the functional and integrative medicine on the other side, again, as you guys know, I love that stuff. You know, I really love it when as physicians, we add that holistic approach. And I know a lot of times people hear holistic and they think like, oh, like it just has to do with Western medicine, or supplements. And it's not necessarily only that, it's really looking at the body as a whole and focusing part of the body. And like Dr. Scott said, that's just so important, because a lot of times things can get missed because you're so focused on one thing and you could be missing another underlying cause. And what I love, I know with functional and integrative medicine, a lot of people can do those courses, but maybe I'm a little partial, but I really love when physicians do it, because there's something to be said. You know, we train for a really, really long time. And no matter what, there's a difference between somebody who has trained and gone to school. Like Dr. Scott Harris says, med school was 6 years. OBGYN is 3?
4.
4 years. That's 10 years alone was her training. So there you have, you're talking 10 years. And then some people do like a 1-year online course, and then all of a sudden they're, you know, doing the functional medicine and people are going to them. I mean, such a difference. Because I just want to put it this way. If you were going to a surgeon, would you want a surgeon who has practiced for, you know, 10 years, who maybe has 6,000 surgeries under their belt, versus somebody who's just coming out and they're like, "Ooh, this is like my second one that I'm doing." And mind you, we're all there. We all had a number 1 patient and number 2, but really you want the best care. And I am totally promoter of always going to a provider who is a physician, because, you know, that's what we go to school for, to take care of you and to take care the best care. Like Dr. Scott didn't go back and get boarded in 2 additional things because she's like, "Oh yeah, all the free time I have." It's because she cares. And she, you know, with unfortunately the passing of her brother, she wanted other people not to experience that. So now we're going to dive into our topic today. So cervical health. So why is cervical health, and as women, why is it so important to keep up with our cervix? That awesome word.
So over the course of my career, things have drastically changed for cervical screening because of HPV detection. When I trained as a resident, we didn't have the assays to measure HPV. So Pap smears were graded totally different. So we've definitely seen with this approach a decrease in cervical cancer. It's just not that common anymore because of the screening programs that have been, you know, constructed. And so I think it's super, another preventable cancer. And I think it's very important for people to get their screening to be preventative.
And it is. And I know, you know, I'm going to be honest, I'm never running, you know, for my pap, like, "Oh yes, my pap," like run and get that. You know, it's like a colonoscopy. I know nobody's ever running to get their colonoscopy. So we totally get it, especially Dr. Scott and I, because we're both women. So we go through it. And it's so funny. I remember getting my first pap, and I told my husband, I'm like, "Oh my goodness, nobody's ever touched my brain." But I just want to say it's almost like somebody touched my brain, because it's just such a weird feeling, because it's inside. I mean, it's so different from like somebody touching your skin, or, you know, it's just a different feeling. And we know that it's not the most comfortable thing, but to tell you the truth, it's so quick. Like, you know, when I do PAPs in my office, by the time I explain what I'm going to do, I always end with, "It's going to go faster than how long it took me to explain everything I'm going to do." So if you haven't had a PAP yet, there's hope. Don't be scared. It goes faster. Of course, if the doctor sees something, like if you have, some women may have a cervical polyp, that's like a little skin lesion or like a skin tag on your cervix, they may take a closer look. Or if they're looking at your vaginal wall or something, or they just see something suspicious, they may take a little longer. So I know we aren't running to get them, but it is very important. So that, with that being said, can you talk a little bit more about how often women should get screenings for cervical cancer?
So this was all recently revised. And so I made sure I had my facts checked. So I will tell you the most recent guidelines. There's 2 different schools of thoughts. One is what the American Cancer Society just recently in 2020 updated. So basically they say if you're less than 25, you need no screening. And here's the thing, the PAP only screens for cervical cancer. But the pelvic exam that you get annually from your gynecologist could potentially screen you for sexually transmitted diseases, which can affect your fertility in the future, and also for other problems, as Dr. D mentioned, with the vagina, and there's also vulvar cancer. So there are other reasons to get your annual exam, except for the Pap smear. So having said that, less than 25, no Pap. 25 to 65, if you get an HPV viral culture or viral screen every 5 years, they say that is sufficient alone. Or if you get the actual Pap smear. So what a Pap smear is actually, we call it cytology, which just means the cells are visualized under the microscope. So the cells of the cervix look a certain way. And so if you only get the Pap every 3 years is sufficient, but if you get the Pap plus the HPV screening, which is called co-testing, that's sufficient for every 5 years. And then over 65, they say you don't need a Pap. Not that they don't care about your health anymore, it's just that the index or the incidence of cervical cancer is rare. So when we're talking about screening guidelines, we're talking about what is the chance and what is the cost of screening a population to prevent a cancer. So the American College of Obstetrics and Gynecology, or ACOG, which is what I'm a fellow of as an OBGYN, revised their recommendations in 2018. They're a little bit different. So they say less than 21, no screening. At 21 to 29, Pap every 3 years, so no HPV screening between those ages. I think the reasoning is that it's pretty frequent to have HPV, and it doesn't usually amount to anything at those ages based on the population studies. Between 30 and 65, HPV alone every 5 years, so that's similar to what the American Cancer Society says, or co-testing every 5 years. So, and they actually they don't give an option of PAPs every 3 years. That's interesting. I know as an OBGYN, when I was still doing office GYN, we were a little uncomfortable with the 5-year thing because it's HPV alone for 5 years between the ages of 30 to 65. I mean, with divorce rates going up and, it's not assumed that you're monogamous in a relationship at those ages anymore.
Yeah, and I know that was a lot of knowledge Dr. Scott just dropped on you. And again, that's why it's so important that you have a conversation with your doctor and let your OBGYN know if there's any family history of breast cancer, any family history of cervical cancer, anything uterine cancer. It's just so important. And, like Dr. Scott mentioned, I know I don't do the 5-year, and I don't know if it's because I'm female. I agree with Dr. Scott that is a pretty extensive time. And even as Dr. Scott mentioned, the guidelines, even before, women used to get PAPs even earlier. It used to be once women were sexually active, and I believe it was 18 that we would start PAPs, and then it changed to 21. And exactly what Dr. Scott said was the reason that we were finding young women with strains of HPV with atypical cells, but because the majority of young women are healthy, their bodies would fight it off. So it's almost like finding a small lump in your breast. So then of course you're going to get scared and anxious and worked up. And let's say when you get like the biopsy or something, it comes back normal. So they were just saying all those tests were really just increasing stress in young women. So that's why they switched the guidelines and pushed the age up. Now, with that being said, just remember, if you have anything abnormal, so irregular periods, heavy bleeding, vaginal discharge, anything that's not normal, you need to let your doctor know, because sometimes people do need a Pap or a pelvic exam before the age of 21 if something else is going on, for us to make sure that nothing else is happening. So important. So definitely make sure you have that conversation with your OBGYN. Be honest about, if you have pain during sexual activity. I mean, all those things. It's your time to talk to your doctor. And just to reiterate, I know people get embarrassed when they have to talk about things like that. And the best part, I'm sure Dr. Scott probably has stories that could last us all day. But sometimes when I go to do an exam, ladies will say, "Oh, I didn't shave my legs." I'm just kind of like, that doesn't matter. That's like, That's nothing compared to some of the things that we see, that, you know, legs that aren't shaved aren't anything big. So just remember that it's not embarrassing for us to talk about, you know, vaginal dryness, pain during sexual activity, pain during urination, irregular periods, your sex drive, you know, anything like that. So just be upfront, because especially with what Dr. Scott's doing, just preventative medicine, and I myself just being a primary care physician, you know, again, we want to prevent things from happening, and we want to prevent things if they're in the early stages to progress. We don't want that to happen. So we're here to kind of nip everything in the bud. So the faster you bring it up with us, the higher chance that these things won't progress. So I know you heard Dr. Scott talk about HPV, and HPV just stands for human papilloma virus. And essentially human papilloma virus is causes for genital warts and cervical cancer. And there's other cancers that HPV can cause. So Dr. Scott, what can people do, more so women? We're really speaking to women here, but also men have HPV, and we'll probably touch on that a little bit, because right now we have a way to detect HPV in women, but not in men. And that's kind of unfortunately a disadvantage, because the school of thought is that when men are giving it to women, but they may not necessarily know that they have it. That's why the cervical cancer screening and your PAPs and things like that are just so important. So talk a little bit more about HPV and what people can do to help decrease their risk of HPV.
So HPV is probably the primary risk factor for cervical cancer. You know, smoking is also one of them. And also, you know, the thought was the risk of HPV was multiple sexual partners, not using a condom or some kind of barrier method to prevent yourself from STD, because it is, as you mentioned, sexually transmitted from men. And so I don't know if the smoking increases your risk because smoking is just hard on your body and you're more inflammatory. There have been a few studies that have also shown that your HPV, your risk of HPV infection has to do with your folate intake, which is interesting. I mean, without going into a whole nother discussion about folate metabolism and MTHFR, we found there to be a link there. And so a lot of my patients, when I did GYN, one of the things we did as soon as they had an abnormal Pap smear was to make sure they were on a B complex vitamin, including folate. And there are some studies that show resolution. And just on as an aside too, as far as risk factors, there was also a study that showed that the longer you're on birth control pills, oral contraceptives, there was an increased risk of breast, but also cervical, regardless of your HPV status, which I found that was actually surprising, because we thought cervical cancer was just related to HPV and not necessarily like synthetic hormones.
But regardless
of that HPV, you know, obviously you need to protect yourself from that. And there are over 50 strains. There's probably more now, because since I haven't been doing GYN for a while, there's probably 70, and they're actually numbered. And we know that there's 4 specifically that are the more high risk types of HPV. 2 of them, number 16 and number 18, have been shown to have a higher correlation with cervical dysplasia, which is precancer, and cervical cancer. And then 6 and 11 are the viruses that are more associated with warts. And so it's not likely that the virus that causes genital warts causes cervical cancer, but there could be some overlap. And if you have one type, you might have more than others. So the vaccine that has been developed has been active against those 4 strains of HPV.
Yeah, and one thing to remember with the vaccine is that, unfortunately, if you have strains, like if you're found to have HPV, like it doesn't reverse it. The vaccine is really protection again. So let's say, like Dr. Scott talked about those 4 strains. So let's say you have 6 for genital warts. And what's nice with the testing is they're able to tell you what strain you have, which is fantastic. So it just protects you going forward. So that's why it's so important to be diligent about what you're doing. Like if you're sexually active and not necessarily who's not in a monogamous relationship, it is very important to look at that. So we're gonna go a little deep here. Dr. Scott has given me permission, which I'm so thankful for us to step into her life a little and talk about something personal, because sadly, Dr. Scott recently lost one of her best friends to cervical cancer. So I know a lot of times when people talk about cancer or other disorders, we always think to ourselves, that's not going to affect me, or it's, not going to affect somebody who I love. But when it's somebody so close, I think it really hits home and makes us so much more aware of it. And I know Dr. Scott is, probably hyper aware of it as an OBGYN and seeing lots of cases in her career, probably less now, like she said, because there's better screening. But again, Dr. Scott, I'm so sorry for your loss. And thank you again for sharing this story with us. So can you talk a little bit about your friend and what happened?
Sure, absolutely, because I know she would want other people to kind of benefit and maybe be preventive because of her story. So she was 50 years old, no risk factors. She was not a smoker, married for 25 years, had really no medical problems, and started having some irregular periods, which is completely normal at that age, right? Because the average age of menopause is 52. So all of us women at that age start having some irregular bleeding. So she told me about it, and because I kind of treated her hormones, and I kept urging her to get in to get some blood drawn. So a couple months went by, and the bleeding was very irregular and got to be much heavier. And so, just to back up a little bit, I guess a year prior to that, she did have a Pap smear. So she had a Pap smear in September, the year before she was diagnosed, and that Pap smear came back normal, but she had co-testing. So Pap smear came back within normal limits, positive HPV. So the guidelines are to do a colposcopy, which even considering her Pap was normal. So she had the colposcopy, she had biopsies, those were all negative. So nothing, no dysplasia, really nothing came up. So per the guidelines, she would be due to repeat her Pap in 1 year, which would be the following September. So she started having the irregular bleeding in June. At least that's when she first told me about it. It could have been before that. And it was the end of August before she actually made the appointment to see her GYN at that point. But by the time she came in, so it wasn't even a year yet. She wasn't even due for a Pap yet, which is the crazy part of it. So she went in and she already had a visible mass on her cervix. So it had grown. Usually when we see patients with precancer or cervical dysplasia, you can't necessarily see it. We put a vinegar solution on the cervix so that the cancer cells would uptake more vinegar and it would look whiter. So it's usually not visible to the naked eye. And even with the colposcope, what we're seeing is not a mass, is usually these white areas or something, or sometimes we can see more blood vessels because cancer's kind of greedy and it takes a lot of blood flow and it takes a lot of blood vessels. So those are things that we can see on colposcopy. So she had a visible mass. She was seen on Monday for her gynecologist. We got the results on Thursday. By Friday, she saw a cancer specialist, a gynecology cancer specialist. And within 1 week, she had a hysterectomy. And so for that treatment, usually what the treatment is called radical hysterectomy, which just means that they remove the uterus, the tubes, the ovaries, and a little bit of the tissue around the cervix in case it spreads, because some cancers spread in the blood, which means they start in one organ, and then it goes distantly, like to your lungs or to your brains. But cervical cancer spreads locally. So that just means it kind of grows out. It doesn't usually get into the blood and go to distant places initially. So she had the surgery, and there was a tiny little bit of cancer in one lymph node. So there's also lymph nodes that get sampled when you have your hysterectomy. That's part of the radical hysterectomy. So her doctor suggested chemotherapy. I think she had 6 rounds of chemo, and she had radiation. And so what she had was whole pelvis radiation. So they just had radiation to her abdomen. And then she also had internal radiation, where they fit a mold to put inside her vagina that gets close to what's called the cuff. Because once we remove the uterus and the cervix, you just sew together the top of the vagina. I don't know if this is too much information, Dr. D, or not.
You're doing great.
So she had all that, which I at the time felt like it was kind of overkill for just one tiny little lymph node that had microscopic invasion. So she went through her therapy, was done in 3 months or so. Her next scan, she got a clean bill of health. So at this time, remember, it's only since her first PAP, which was not even abnormal, which was normal, it's not even been 2 years at this point. And remember, we talked about co-testing 3 years, PAPs every 3 years, and in this age group. So this is why it makes me a little nervous, because hers progressed so quickly. After she got all the therapy, at the 1 year mark, she was okay. A couple months later, she started having some visual issues, and the cancer had come back in the back of her eye, a place in her spine, and some random places. So unfortunately, when cervical cancer is very, very treatable in its early stages, but when it comes back, it's very hard to treat. And it's not always responding to chemotherapy. So she continued to have palliative radiation, which what that means is they would just do radiation at the places that the cancer was so she could feel less pain. And she also had chemo, but unfortunately, the cancer just was a very, very aggressive type. And she passed away. I think it would have been just shy of 2 years from her diagnosis. Actually, yeah, because I think she was diagnosed on August 31st. She died on August 26th. So just under 2 years from her initial diagnosis. Yeah.
So sad. I'm so sorry again. And thank you so much for sharing that in such a young age. I mean, when you look at 50, I feel like 40s and 50s are the peak of life. People, if you have children, your kids are grown up, you can start enjoying, the fruits of your labor during that time. And she also had a family. So please, just keep her family in prayer, that during this time that, God just gives them the strength. And even with Dr. Scott, again, it's hard losing somebody that you've known for years and you've been such a good friend with. And thank you again, Dr. Scott, for sharing that personal story. And ladies, this is why it's so important that we need to take care of ourselves and our bodies. And I know as a mom, I feel moms do a great job. We have that sixth sense with our kids. Like I always tell my moms, if you feel something's wrong with your baby, just call. Like I never tell moms not to call. Once a mom feels something's off with their child, I know something's off for a mom to call me. And it's the same thing with women. If you feel like something is off and not right, just go get checked out. And even like Dr. Scott mentioned, and we don't know, if you're having an irregular period, as women, we have a tendency to put our own health and ourselves on the back burner because we're taking care of everybody else and doing things for everybody else, that we get too busy for ourselves. But we can't enjoy life. We can't enjoy each other. We can't enjoy our families if we're not healthy. And so you also have to put that in perspective, that you may say like, well, who's going to pick up the kids and who's going to do this? But if you're not around, who is going to pick up the kids and who's going to do that? So it's better to, take a day off and go get your checkups and go do everything you need to do. So thank you again. So remember, so you guys heard Dr. Scott talk about cervical cancer screening. I'm so excited because Dr. Scott, she will be on again. So don't worry. I know for a fact I've enjoyed her, and I hope you guys have also enjoyed her too, because for sure She'll be on again, giving us her expertise in regards to women's health and even just her own personal experience. I can't wait for her to be on. She has her own amazing story to tell. And I haven't heard the whole story, but I can't wait to hear the whole story, because I want to hear it for the first time too when you guys hear it. So so we talked a little bit, again, just to remind you that with cervical cancer, really connect with your OBGYN. Make sure that you're getting your PAPs on time when you need them. Don't forget that if your PAP is abnormal, your OBGYN may have you come back in 6 months, in a year. So don't forget to follow those guidelines, because if they do see something atypical and something that could be precancerous, they may want to do additional testing or screening. So please keep track of that. So Dr. Scott, thank you again for being on. I do want to ask you, I have on here how you can connect with Dr. Scott. So definitely make sure you can hook up with her, follow her, and support her on Facebook at Revitalize Med, on Instagram at Revitalize Med, and of course on our website, www.revitalizemed.com. And do you do virtual visits?
I do virtual visits. I'm licensed in Ohio, Florida, and Montana. So we do also offer a second opinion kind of virtual visit for patients who are out of state that we can't work with. And I also forgot to mention, I have a YouTube channel, just Tara Scott MD. So there's lots of videos there. I mean, I'm very passionate as well about education. So you can kind of Google and search out videos there, that we're still trying to add more and more videos there as well.
So definitely check out Dr. Scott here. I'm posting it up here. So Tara Scott MD on YouTube. Make sure you subscribe. I have her information scrolling at the bottom again. Facebook, Revitalize Med, Instagram at Revitalize Med, and her website, www.revitalizemed.com. Again, don't forget to support her. Subscribe to her channel. Tara Scott. No, I agree with Dr. Scott that is a pretty extensive time. And even as Dr. Scott mentioned, the guidelines, even before, women used to get PAPs even earlier. It used to be once women were sexually active, and I believe it was 18 that we would start PAPs, and then it changed to 21. And exactly what Dr. Scott said was the reason that we were finding young women with strains of HPV with atypical cells, but because the majority of young women are healthy, their bodies would fight it off. So it's almost like finding a small lump in your breast. So then of course you're going to get scared and anxious, and work to do is so my kids know. And I love what Dr. Scott is doing, because her kids know that they are not limited to one box. They are not limited to one degree. And I love it. Just because you've done one thing doesn't mean you can't do other things. So that's the legacy I want to leave. And, you know, hopefully I live for a very, very long time. I take good care of myself. But just because you're not dead doesn't mean you can't leave a legacy. You can be alive and be a trailblazer and have a legacy. And that when people talk about you, they, you know, the words impact, empowerment, encouragement, just all these awesome words come to mind when they talk about you. So it's never too late. Don't wait, you know, for your tombstone to have that, oh, this person left a legacy. No, you can leave your legacy today. And you can check that out at http://aleapublishing.com. Again, thank you, Dr. Tara Scott. And then, of course, remember, life is priceless and precious. You are amazing, and you can do anything you put your mind to, because you are a superhero. Just have faith over fear, and God bless. And of course, don't forget to wash your hands, kiss your kids, love your family, and say your prayers goodnight. Love and peace from the Dr. Mom Show. Bye, guys. Love you.